Hi again, it's Dr. Gordon. This is such a great question, and I'm glad you asked it. Let's clear something up, though. The first thing we need to talk about is the fact that GLP-1 medications are approved for chronic use in the treatment of obesity because obesity is a chronic disease, just like hypertension, just like diabetes, just like asthma. So the idea that people are not supposed to be on them long term is a misunderstanding of the disease, not the medication. Now, does that mean that everyone should be on a GLP-1 forever? Well, not necessarily. It depends. It means the duration of treatment depends on physiology, not morality, not willpower, and not whether someone feels they deserve medication. Some people stay on a GLP-1 long-term because it quiets pathologic hunger, it improves insulin resistance, it reduces inflammation, it stabilizes weight in a body that has repeatedly defended fat. And yes, some people notice benefits in things like food noise and even ADHD-like symptoms. And that's because GLP-1 receptors exist in the brain. It's biology, not a side effect. The real question isn't, is it approved for secondary benefits? The question is, does this medication meaningfully treat the underlying disease process for this person? If the answer is yes, then long-term use is medically appropriate. But, and this matters, GLP-1 should never be prescribed in a vacuum. Long-term use requires ongoing assessment, muscle preservation, nutritional adequacy, hormonal context, especially in midlife women, and periodic reevaluation of whether the medication is still needed at the same dose or at all. And that's why working with a physician trained in obesity medicine matters. This isn't about staying on a drug forever. It's about treating a chronic disease responsibly over time. So if you've been told you should just stop once you lose weight or that needing medication long-term means you failed, you've been given outdated non-medical advice. Obesity care is long-term care, and it deserves the same respect any other chronic disease receives. Follow me for more tips in obesity rooted in facts, not fiction.